The Silent Pandemic: Mental Health Lessons from COVID-19 in Canada. During COVID-19, we talked a lot about hand washing, vaccines, and flattening the curve. But there was another crisis unfolding quietly across Canada: the mental health crisis. Anxiety, isolation, and burnout became part of daily life. This is the silent pandemic, and it taught us just as many lessons as the virus itself. One lesson we did learn was this: mental health is essential, not optional. During the COVID-19 pandemic, crisis lines and mental health services across Canada reported significant surges in demand, experiencing more than the double the usual volume of calls and texts. In response, services adapted. Virtual counseling became widely available. Kids Help Phone, for example, saw over 4.6 million connections with young people in 2021 alone. Public conversations around mental health also became more open, less stigma, and more support. But many struggles were not new. Healthcare workers experienced burnout on a massive scale. A 2021 survey by the Canadian Medical Association showed half of physicians met the criteria for burnout. We also saw gaps in access. People in rural and Indigenous communities were far less likely to get the help they needed. These patterns of underfunded care and unequal access were things we had seen before. COVID did not create them, but it magnified them. And then there were the lessons we lost. We knew that isolation could worsen dementia or depression, but in long term care homes, many seniors were left alone for months. Even after warnings from physicians and families, support came too late. Stats show that nearly 80% of COVID-19 deaths in the first wave were in long term care homes. That wasn't just a physical health failure, it was emotional neglect. I remember classmates who stopped showing to online classes, friends who said they didn't feel like themselves anymore. Even I struggled to stay motivated some days, but I also saw how one call, one message, or one listening ear could make all the difference. If we want to prepare for the next pandemic, we can't forget the emotional toll of this one. We need to invest in community based mental health programs. We need to support frontline workers not with just the protective equipments, but with emotional support. And we need to treat mental health with the same urgency as physical health, because health is health and silence is not safety. Thank you for listening.